Thanks for that great intro. Let me first share my screen here. Even with a year plus working from home and Zooming all of the time, I still get a little worried that my screen isn't sharing correctly or something like that. So hopefully I'm in full screen mode now and
You
everyone
are.
is seeing my first slide here. Okay, perfect. Thank you. So I will go ahead and get started. I just want to add a quick disclaimer as I get started here that I am working from home. And so I have two terrible coworkers that work with me, a cat who's sleeping in his box directly next to my computer right now, as well as an old Chihuahua sitting on my lap. She gets jealous when I talk too much and she starts to cough. So if you hear what sounds like an old grandma coughing, it's just my Chihuahua, and I try and throw her off my lap to go get a drink, and she comes back and lays back down. So with that, I wanted to go ahead and jump right into the Community Health Worker Collaborative of South Dakota and provide not only an introduction to community health workers, but also the Community Health Worker Collaborative of South Dakota, and then also share some insights into our strategic plan, the work that we're planning to do, things like that, in hopes that if you're in South Dakota, you'll join us and work with the Community Health Worker Collaborative to expand the reach of CHWs in South Dakota. If you're joining us from beyond South Dakota, we always love to connect with other states, learn what other states are doing, learn the work that they're doing, and hopefully also offer some insight to what South Dakota is doing so that other states can utilize the resources that we've utilized. And that's something that we've been doing for the past year or so, is really connecting with other states and learning from other states that have a much more established community health worker workforce. So first, I really want to just dive in and ask, what is a community health worker? I know there's many different definitions out there, and so it's important to make sure that we're all on the same page definition-wise. So the definition that the Community Health Worker Collaborative of South Dakota, as well as the South Dakota Department of Health, has adopted is the American Public Health Association's definition of a community health worker. In addition to South Dakota, 20 some other states have adopted this definition, as has the National Association of Community Health Workers. So it's leading down that path of this being the national definition of a community health worker once there's a national workforce for community health workers. So this definition is kind of long here, but the American Public Health Association's definition is that a community health worker is a frontline public health worker who's a trusted member of and/or has an unusually close understanding of the community served. And this trusting relationship enables the worker to serve as a liaison or a link or an intermediary between health and/or social services in the community to facilitate access to services and improve the quality and cultural competence of service delivery. So with that very lengthy definition there, I also like to show this visual because I'm much more of a visual learner than kind of a textbook definition type learner. So you'll see here we have the three circles, and on the left we have the communities, and on the right we have the health and social services system, and in the middle we have that community health worker there. And those arrows show the overlap. So on the left-hand side, the overlap with the community, that community health worker might physically live in the same community that they're serving. This is especially important in our smaller and rural communities. They might be from the same background as the community that they're serving. They might speak the same language. They might share similar or the same cultures. They might have the same chronic disease as the community that they're serving. They might have the same lived experiences when it comes to maybe substance abuse and recovery. And then on the opposite side, where it overlaps with the health and social services systems, that community health worker might be employed by the health or social services system. They might work closely together with them. They might receive provider referrals to their community health worker program from that health or social service system. So there's really many different ways that that community health worker can be connected to both the community and the health or social services systems. So moving on here, I also like to share the three titles that we use for community health workers here in South Dakota. The first title is just community health worker, and that's an individual who's completed some form of formal training and works under that American Public Health Association definition of a CHW. The second title that we use is certificate level CHW. So a certificate level CHW is an individual who has completed an approved CHW training certificate in South Dakota and also works under the American Public Health Association definition of a CHW. And certificate level we'll jump into in a little bit here, but certificate level really means that that individual is able to work under the full scope of work for Medicaid reimbursement here in South Dakota as a CHW. And then the third title that we utilize here in South Dakota is Community Health Representative, or CHR. And so a CHR is an individual who's completed an approved CHR training program through Indian Health Service and works under the American Public Health Association definition of a CHW, as well as the IHS definition of a CHR. And so South Dakota, when creating the workforce and building out the workforce here in South Dakota, and when launching the Community Health Worker Collaborative and looking into these definitions, really wanted to make sure that we emphasized the community health representatives because they are CHWs, but we want to keep their title separate to make sure that we're raising awareness and really promoting the great work that CHRs have done for decades and decades within our state. The CHR program goes back to the late 1960s, and so we really want to keep that title separate while still recognizing CHRs as part of the community health worker workforce. So we don't want to take over that title. We want to embrace it and welcome the CHR title into one of the CHW titles here in South Dakota. So there are opportunities to utilize other titles as well. We in South Dakota call this a dual title. And so the reason why we're supportive and encouraging organizations to use the dual title is for a couple different reasons here. The first is that it can tie the work that you're doing back to the specific area of work that you're doing. So for example, my title at the bottom there, if you're an opioid prevention specialist, you would be an opioid prevention specialist and maybe an opioid prevention program or a substance abuse and treatment program. And so that title would directly connect you to the work that you're doing. But then we'd also want to make sure that you continue to use that certificate level CHW title as well, because as we continue to grow the workforce and continue to raise awareness about CHWs, the CHW title and work that CHWs do will become more apparent. And then that also connects you then to the CHW workforce as well. So you're able to connect with that specific workforce and connect with them as well. I did see in the chat here, somebody asked if they can get a copy of this PowerPoint. Absolutely. I will share this PowerPoint with everyone. I apologize. I should have mentioned that at the beginning here, because if you're a note taker like me, you're frantically trying to keep up with the notes here, and there's a lot in this PowerPoint. So I will absolutely share that and make sure that that's sent out to all attendees today. So next, I want to take a look at what the community health worker scope of work looks like here in South Dakota. So our scope of work here in South Dakota is South Dakota specific. This was developed back in 2016 by a work group that developed key recommendations for community health workers. And that work group was hosted and coordinated by both the South Dakota Department of Health and the South Dakota Department of Social Services. And one of the key recommendations was to develop a South Dakota specific scope of work while still making sure that that scope of work aligned on a more national level as far as what other states are doing when it comes to the scope of work for CHWs. So in South Dakota, there's 3 areas to the scope of work. There's health system navigation and resource coordination. There's health promotion and coaching, and then there's health education to teach or promote methods and measures that have been proven effective in avoiding illness and or lessening its effects. So those are really the 3 areas of the South Dakota specific scope of work. So just to add a little bit more clarity and provide more information, we have developed a rack card and a slick sheet or infographic that is available to better explain what the titles are that we use here in South Dakota, example scenarios regarding those titles, as well as the infographic or slick sheet that goes through not only the titles and the definition, but also the scope of work and the training as well. So these are just about live on our website, and you can go on the website and not only take a look at these, but also order copies of them as well if you want to share with others. So I just want to touch a little bit on CHW reimbursement, because that really is what's driving the work of the Community Health Worker Collaborative. So South Dakota does have CHW reimbursement for community health workers, and this reimbursement launched April 1st of 2019. And it was perfect timing, just as that work group was wrapping up and developing those key recommendations. The Centers for Medicare and Medicaid came to each state, including South Dakota, and their South Dakota State Medicaid and said, we recognize the importance of community health workers. If your state wants to make amendments to the Medicaid state plan to include reimbursement for CHW services, you are certainly welcome to do that. And so South Dakota was one of the states that jumped on that opportunity, was able to amend the state plan to include CHW reimbursement through South Dakota Medicaid. So what's unique about South Dakota is that we have reimbursement, but we don't really have a workforce outside of our CHRs. So really the CHRs are the CHWs who are working here in South Dakota so far. There's a couple, maybe 5 or 6 different grant-funded CHW or CHW-like programs, but other than that, we really don't have a workforce here in South Dakota. So that's part of where the Community Health Worker Collaborative of South Dakota comes in, is that we're really focused and working on raising awareness about CHWs and helping to develop that workforce so that we can have the workforce to do the CHW scope of work to then receive that CHW reimbursement and make sure that the programs are sustainable. So I just want to give a quick overview of what reimbursement looks like for CHWs in South Dakota. Individuals have to have either a qualifying condition and or a qualifying barrier. So here's the list of qualifying conditions here: chronic diseases, substance use disorder, tobacco use, mental health conditions, etc. So it's an and or. The qualifying barriers being geographic distance from health services. So here in South Dakota, we have a very rural geographic setting here in South Dakota. So many would qualify just based on their distance from health services alone. We also have a lack of phone. So the individuals may be going to the emergency room or going to an aftercare, urgent care type setting versus calling to make an appointment or visit with a nursing line. And then cultural or language communication barriers. So both, not speaking English as a primary language or not being fluent in English, but also just the communication barrier. Healthcare is very complex, and just understanding even the basics of healthcare, that's something that many people have a problem with. And there's no shame in having that problem, but it's helpful to have that community health worker there to really help walk through and help that individual understand the complex medical terminology and things like that. I know just even trying to pronounce some of the doctor's specialties can get a little bit tricky. So, when they start talking medical jargon and all of those terms, that's when it can really become confusing for a patient, and that can lead to, the patient not following instructions. The provider title that I always have problems with and have to say a little bit slowly is gastroenterology, because that's one of those that's kind of tricky to say fast. And so, certainly something to note that there's cultural and language communication barriers, but they extend beyond just speaking the same language. So you'll notice that the Medicaid specific CHW scope of work is almost identical to the South Dakota specific scope of work. The only thing changed here is the wording here. So instead of including helping a patient find a provider, it's including helping a recipient find Medicaid providers. So the main 3 areas of the Medicaid specific scope of work are all the same, whether it's South Dakota specific or Medicaid specific. It's just some of the finer print that changes a little bit. I just wanted to touch quickly on reimbursement rates and what those look like, just because this is really what tipped the scale to allow us to really develop the community health worker workforce. Obviously, reimbursement isn't the only piece of the puzzle. There's also the return on investment, and also the increased patient satisfaction, increased provider satisfaction, et cetera, et cetera. But reimbursement, or talking money, is really what gets organizations and programs interested in learning more about CHWs and wanting to ask those next questions. So here in South Dakota, we can provide up to 104 units of service per year, which for someone like me who doesn't really like math, that equates to 52 hours of service per year. And that can be done in half-hour increments. So it could be a half hour today, a half hour tomorrow, a half hour next Monday. It can be done in hour-long increments as well. So it could be an hour today, an hour tomorrow, an hour in July, an hour in August. It's really up to the care plan from the provider and the community health worker to figure out what will work best for the patient. And there is a limit, though, of 52 total hours per year. And these services can be offered in both an individual setting as well as in a group setting as well. And we utilize CPT codes through Medicaid reimbursement. So for billing offices looking to onboard for that reimbursement, it's really simple knowing that we have those CPT codes available. And then we do have a reimbursement estimator where you can put in the number of reimbursable hours per week, and it'll show the difference between the salary and benefits for that CHW. So obviously, all 40 hours a week of a CHW position is not reimbursable. You'd have to probably work 50, 60 hours to get that to balance out. But maybe 15 or 20, even 25 hours of a 40-hour position could be reimbursable. And so it looks at the difference between the hourly rate versus the reimbursement to kind of show the difference and show that it's not as daunting of a financial task to take on a CHW program and to start up a CHW program. So there are a couple additional requirements. The first is that the CHW services must be provider ordered. The CHW must be employed by and supervised by an enrolled CHW agency. And the next line or bullet looks kind of concerning, but it's actually not. What it really means here is that there's some additional policies and procedures that must be submitted to South Dakota Medicaid before you can be reimbursed for CHW services. That's something that the CHW SD as well as Medicaid are continuing to work on and streamline to make easier, in hopes that there might even be the option in the future to just send you a fillable form to fill out. Some of the things that have to be submitted are what training program did your CHW go through? Has your CHW completed HIPAA compliant training? Has your CHW received CPR training and they're CPR certified? Things like that. And then CHWs must also have completed training through an approved South Dakota Department of Social Services Medicaid CHW training program. So just to give you a quick overview of what our training programs look like here in South Dakota, we have 2 certificate level CHW training programs. The first is through Lake Area Technical College, which is in Watertown, South Dakota. They offer a CHW certificate, which is 1 semester, diploma, which is 1 year, and the diploma is meant more for individuals who don't have previous experience. Maybe they're right out of high school and need a little bit more of the background courses, like an intro to anatomy course, an intro to communications course, courses like those. And then the certificate and the diploma can then build up to an associate's degree. And then the CHW certificate is also embedded in 2 different associate's degrees at Lake Area Tech. So both the Human Services Technician, MA associate's degrees, graduates also having a CHW certificate, meaning that they're more marketable when they are job hunting. So Lake Area Tech certificate and diploma are both offered online, and then the associate's degree is offered almost entirely online as well. And what's unique about our Medicaid reimbursement here in South Dakota is that South Dakota Medicaid has grandparented in the Indian Health Service Community Health Representative Training Program. So that was a great win for Medicaid reimbursement in South Dakota, as it allows all CHR programs to work through that training and work through some of the policies and procedures and onboard as an organization providing CHW services and being reimbursed through South Dakota Medicaid. Southeast Technical College in Sioux Falls is also working to develop a CHW certificate and also embed their certificate into a couple of associate's degrees there as well. And then here in South Dakota Medicaid can also review training programs on a case-by-case basis and approve those individuals to work as CHWs here in South Dakota. And that's really helpful when looking at building out the workforce. We have training programs over in Minnesota, just across the border. We have, maybe an individual moving here from Texas or Florida, and they've trained as a CHW there. And so they can take that training program directly to Medicaid and have them look at what their curriculum looked like and what training they received, and then approve them to work here in South Dakota. This is where it gets a little bit confusing. We also have specified training programs here in South Dakota. There's 3 right now, but we expect this list to continue to grow. The first is the Family Spirit Home Visiting Program, which is a tribal home visiting program. I believe it's through Johns Hopkins University, but I could be wrong. But the Family Spirit Program is more of a specified training program, as is the National Diabetes Prevention Program, which is a 16-weekly class program, followed by 6 monthly classes that helps patients with prediabetes delay or prevent the onset of type 2 diabetes by losing weight, eating healthy, exercising, etc. And then we have Better Choices, Better Health, SD, and the Lay Leader training. Better Choices, Better Health is a lifestyle change program here in South Dakota. That's 6 weekly classes that helps individuals learn life skills to better manage their chronic diseases here in South Dakota. So how the specific training programs tied to reimbursement is kind of twofold. The first is that the CHWs can train in these programs to expand the services that they are able to provide, specifically in a group setting. So for example, a community health representative in South Dakota would be able to be reimbursed, or their organization could be reimbursed for their services because the CHR training is an approved training program through Medicaid. But that CHR could also go on and go through the lay leader training and then also offer Better Choices, Better Health in a group setting and be able to bill Medicaid for those Better Choices, Better Health classes for the patients who are on Medicaid within those classes. The other way that this looks, or the way that it works, is that individuals who've trained to lead these programs but are not CHWs, so for example, a dietitian who's trained as a lifestyle coach for the national DPP, they could be reimbursed as providing a service of the CHW scope of work using the appropriate CPT code. So just because you've trained as a lifestyle coach through the national DPP, that doesn't make you a CHW, but it allows you to provide that health education piece of the CHW scope of work, and then you can bill using that appropriate CPT code. So really our big push is, as we continue to develop the CHW workforce across the state, we want to add on specified training programs that those CHWs can offer, but also realizing that there's opportunities for individuals such as this dietitian example leading the national DPP, where individuals can be reimbursed for providing that specific service. So now I want to give just a quick overview of the Community Health Worker Collaborative of South Dakota. I know going through Medicaid reimbursement is a little bit South Dakota specific. The Community Health Worker Collaborative of South Dakota has done a lot of work that can really apply to states outside of South Dakota as well. And so I'll go into that a little bit more in detail here, the work that we've done and how we can hopefully help others in other states as well. But really our mission is to promote, support, and sustain the community health worker profession in South Dakota with a vision of a well-established statewide network of CHW professionals who provide a wide range of services for South Dakotans. And so just to give you a little bit of a timeline here, in 2015, the South Dakota Department of Health conducted an environmental scan and statewide analysis of the CHW workforce. So what we did is we connected with 45 or so different organizations across the state and just sat down with them with some interview questions and checked in to see, does this workforce look like something we need in South Dakota? Is it something that your organization would be interested in? Should we continue the conversation and the work to start to develop that CHW workforce? And so overwhelmingly, the response was yes. So then, as I mentioned previously, in 2016, Department of Health and Department of Social Services facilitated that work group to develop the key recommendations, which wrapped up at the perfect time for South Dakota Medicaid to jump in, and they were able to amend the Medicaid state plan. And then in 2019, they announced the CHW services as a covered service of South Dakota Medicaid. So in 2019, although there was reimbursement, there still really wasn't any traction in developing a workforce. So in 2020, the Department of Health introduced the Community Health Worker Collaborative to really promote and develop the CHW workforce in South Dakota. And obviously 2020 was a challenging year for all of us. And so we were able to virtually pull off a strategic planning session and develop a 3-year strategic plan for the Community Health Worker Collaborative of South Dakota. And then in 2021, really our focus is to promote the profession and develop pilot CHW programs across South Dakota. So just to give you a quick overview of the 2020 work that was completed, especially noting that this can be helpful in other states, as they continue to explore CHWs and expand the workforce in their states as well. Obviously, we developed our website and our branding, really built out the organization, things like that. But what we did was we conducted a 50-state environmental scan. So we looked at all 50 states. We looked at what their workforce looks like, what organization leads or guides their workforce, if they have a statewide association or organization, how their state Department of Health or equivalent is involved, what reimbursement they have, if any. We really looked at anything and everything for each state. And in doing so, we narrowed it down to 8 states that we really wanted to look into further because they were either replicable to South Dakota or just states that are very successful with their CHW workforces. And so we want to strive to be like those states. So for example, one state that I connected and interviewed with out of the 8 states was Arizona. They're almost a copy paste of South Dakota. Obviously, they have much warmer weather, but they have a couple urban areas, as we do here in South Dakota. They have a lot of rural areas. They have frontier areas, and they also have tribal programs across the state as well. So it was really nice to connect with states like Arizona and New Mexico that have a really established workforce and are also working really closely with their CHRs and working kind of in the same direction that we're working here in South Dakota, and that is to continue to recognize and raise awareness about the work that CHRs have done for decades as the rest of the state almost catches up with developing a CHW workforce. Other states like Texas, Massachusetts, Florida, obviously not at all comparable to South Dakota when it comes to population or geographic setup, really, but they just have really successful workforces and have really grown the profession. Especially Massachusetts, they have CHW reimbursement through Medicaid. And then they've also, through that, been able to launch CHW reimbursement through private payers as well. And they just have a really developed workforce in Massachusetts. Minnesota, our neighbor to the east, is unique in that they're both a little bit like South Dakota, especially outside of the Twin Cities metro area. Minnesota has a lot of rural areas like we do here in South Dakota. But then they also have Medicaid reimbursement in Minnesota as well. So they're certainly a state we continue to stay connected with and learn from. In 2020, we also launched a South Dakota survey to survey all current hospitals, clinics, healthcare organizations, tribes, behavioral health and substance abuse programs, et cetera, to just ask more questions about the CHW workforce, make sure we're headed down the right track. Obviously, COVID-19 didn't get us to make as much traction on that survey as we were hoping. We had about 45 respondents, but we still overwhelmingly heard from those responses that the CHW workforce is something that we really need to develop and continue to develop here in South Dakota. Then, as I mentioned, we launched our strategic plan. We connected and developed relationships with those training programs here in South Dakota. And then we developed the CHW planning and assessment toolkit. I'll share more about that in a second here. And then really just for the rest of 2020 and even into 2021, like I'm doing today, we've just worked to share introductory presentations and have those introductory conversations about how different organizations can work together and work with the Community Health Worker Collaborative of South Dakota to really develop out the workforce of CHWs across the state. So I want to dive into the South Dakota specific CHW planning and assessment toolkit. This toolkit launched in February of this year. It's a 4-module toolkit, which provides a really comprehensive South Dakota specific overview of the community health worker workforce and what planning and what preparing and starting a CHW program looks like. So there's both a self-guided resource version where you can kind of jump in and jump out as needed based on which section you're working on. And then there's also the CEU version, which requires you to go through start to finish. But once you go through start to finish, you'll be awarded 2 free CEUs. And so this is something that we're really working right now to promote to healthcare practitioners, providers, support staff, et cetera, across South Dakota, not only to get them to better understand what a CHW is, but also to get them thinking and talking about how could a CHW help their organization? How could it assist with their day-to-day activities, things like that. So there's 2 free CEUs available for medical nursing, social work for individuals through the Board of Addiction and Prevention Professionals, for pharmacists, including pharmacy technicians, for dentists, including dental assistants and dental hygienists, for counselors, and then there's also a general certificate as well. And some of these CEUs can be awarded to individuals in other states. It would just be up to you, if you're, say, a social worker in a different state, to check with your Board of Social Work or whoever manages your license to make sure that these CEUs would apply to you. And then there's also that general certificate as well. So you can always take that to your organization that awards you your continuing ed approvals and see if they'll accept that as a continuing ed opportunity. But the toolkit, as I mentioned, is 4 modules. It starts with a CHW background. So looking at what is a CHW, what do, what don't they do, what titles do they use, etc. Module 2 goes into planning. So looking at how would the CHW fit into the care team, who might manage the CHW, what things do you need to get in order to start a CHW program. And then module 3 really looks at implementation. So who, what training programs are available out there, who might be a good fit for our CHW program. It includes sample downloadable job descriptions and sample interview questions, guidance for how to manage a CHW when you don't have a CHW. And then module 4 looks at the evaluation and sustainability piece. So not only evaluating the program and making sure that it's running efficiently and that the CHW is doing the work intended to do, but also looking at that sustainability piece. So how can we maybe continue to expand our program while also continuing to expand the services and the reimbursement through Medicaid? Or are there other funding sources that we can tie into to sustain this position? Maybe we can use data from the program to calculate our return on investment and use that to take to our administration and prove that, for every dollar invested in our CHW, we've saved $5, things like that. So the toolkit is a really great tool to take a deeper dive into, and also really a tool that you can use within your organization and within your community to promote to other professionals and organizations, to have them go through the toolkit and really get a much better understanding of the CHW profession. So just to give you a quick rundown here too, the CHWSD is able to really provide technical assistance and support here in South Dakota through tangible resources such as our planning and assessment toolkit. We have our strategic plan, and then we have many education materials as well. And then as far as service and support, we can really connect with individual organizations to meet and help you plan a CHW program, kind of map out a timeline, what implementation could look like, etc. And then I can also really connect you closely with a contact at South Dakota Department of Social Services Division of Medical Services, which manages South Dakota Medicaid. Her name is Samantha, and she can really dig deeper into how to get Medicaid reimbursement started for your new program that you're launching, or maybe for a CHR program that's already well established. And so now I just want to wrap up here with going through our strategic plan and just share our 5 goals of the strategic plan and the work that we're doing there for the next 3 years. So the first goal is awareness, and our big focus there is to really just introduce, summarize, and explain the CHW profession. It's a profession that it continues to grow and emerge nationally, and so here in South Dakota, we really need to continue to connect with individuals and organizations across the state to introduce and explain the profession. So I won't dive into our objectives there at all. I'll let you take a look at those and also visit our website, which I see Sean put in the chat here. Our website has a link to both a one-pager slick sheet for the strategic plan and also our full strategic plan as well. But really our current focus is to provide an overview of the CHW profession, really promote the CHWSD as a resource. And so we're doing that here through conference booths, fingers crossed that we can continue to all get our COVID shots and continue to resume to our new normal here. And then also promoting the CHW planning and assessment toolkit. And we've developed a pretty comprehensive marketing plan to promote that toolkit to professionals across the state. And then we're working now to develop an awareness task group to really make sure that we're connecting with all organizations to promote that awareness. So the second area is training. We really want to focus in on training, not only our current training programs, but also assist other organizations in developing training programs. So whether it's a full certificate level training program or whether it's a specified training program, we really want to make sure that we're zoning in on those training programs and they're supporting them. So we really want to make sure that we promote the differences and similarities in those training programs, and then also work to provide an overview of those CHW titles as well. Our third area is workforce development, so really promote the position and scope of work and help to get CHWs integrated into the community as well as into the medical and social services organizations. So we're really working to just start that awareness piece and that workforce development and promotion by promoting the CHW planning and assessment toolkit. And then we also have those CEUs, which will hopefully put a little sugar on top and help those professionals to go through that toolkit, knowing that there's CEUs at the end that they can use. And then also assisting pilot programs in developing CHW pilots, and then also continuing to develop a working relationship with CHR programs across the state. So unfortunately, in this past year of 2020 with COVID, I wasn't able to travel anywhere. And so on my 2021 to-do list is to go out and visit all of the CHR programs in South Dakota and really learn from those programs, shadow a couple CHRs for the day, and really develop a better understanding of all the work that those CHRs do, because that work and the work that those CHRs do can really help to build the workforce across the rest of the state just by sharing all of the work that CHRs do and all of those successes. So I know I've been able to connect virtually with a couple of the CHR programs across the state already, but I'm really looking forward to jumping in the car, driving across the state, and meeting all of the CHR programs across the state. Then our fourth area is reimbursement. So looking to educate organizations regarding CHW reimbursement while also working with payers to cover CHW services as well. So our goal there is to expand beyond just Medicaid reimbursement, but also have private insurance, private payers cover CHW services as well. So really our current focus on this for 2021 is to just share information regarding Medicaid reimbursement. It's certainly a lot to take in and a lot to look into, and involves different departments across your organization. The billing department, the finance department, the clinic manager, all the different individuals who need to come together to get an organization onboarded for Medicaid reimbursement. Then our last area of focus is our career ladder or lattice focus. So this is really promoting the cross-training of healthcare professionals to also train as CHWs, and then also ensuring that CHWs have the skills and tools needed to advance their career as well. So here in South Dakota, the Community Health Worker Collaborative sees CHWs as a profession, not a stepping stone. And we definitely see this through the CHRs across our state. There's CHRs who have been in their position for 10, 15, 20, 30 years. So we really don't see the CHW position as a stepping stone. We see it as a profession. So we really want to reiterate that as we're introducing CHWs, and then also take a better look at what the career lattice could look like. So we're looking in different areas to find out, especially in our smaller and rural communities, if there's an opportunity for an individual to maybe cross-train. And so maybe they work as an EMT with a local ambulance service, but then also cross-train as a CHW, and then they can split their time between the two. Or maybe in a smaller community where there's a nursing home and a hospital and a clinic, we could have an individual work as both a CNA in the nursing home and then a CHW in the hospital and clinic. And together that could equal one full-time position. So that's really what we're looking into right now, is where can we cross-train or incorporate that career lattice piece so that CHWs can really work out in those smaller and rural communities, and also work with the populations that they're already working with in other professions as well. So thank you everyone for jumping on board today for this presentation. I hope it was informative and provided you with more information about CHWs and the Community Health Worker Collaborative of South Dakota. I'm certainly interested to hear what questions and comments you all have. And I should have asked in the chat early on here where everyone was from, because I'm hoping even if you weren't in South Dakota, this was still helpful in some way, shape, or form. And I would certainly end with my contact info here in case you want to reach out individually. Obviously, an in-person conversation would be awesome. I can't wait to start putting miles on my car again here. But in the meantime, certainly feel free to reach out by phone or by email as well. So with that, I will welcome questions. And I'm wondering too, if I need to go to the Q&A, if that's separate.
I don't see anything in the Q&A, Ben.
Okay.
But if anyone at any time, you're able to enter either in the Q&A or the chat. If you have a question for Ben, so much you covered here in such a short time. Thank you for providing your contact information. We'll make sure to include that in our post email as well. Let's see. I think I have a couple things for you. I believe you mentioned, I didn't catch her last name, Samantha, who is...
Yes, yep, Samantha Hines. She's the contact for Medicaid. So I know enough to be able to educate others, but I don't quite know enough to always have the answer. So she's somebody who I email and call frequently. She probably rolls her eyes and she sees all my emails coming in, but she is a super great help and wonderful to connect with and can answer any and all questions about Medicaid. I see Nicole in the chat asked or said that she's interested from the Cheyenne River Sioux tribe. That's awesome. Nicole, if you would reach out and send me an email, I'd love to connect further with you and take a road trip out west. I'm in Sioux Falls, so take a road trip out and visit you as well in the future. And then I see Linda asked if we can use the microphone for a question.
Yes, Linda, you are unmuted, and I can unmute anyone else who would rather do a voice message, and that would, I think we would prefer that anyway.
Thank you. My question, I run a federal grant program that operates in 7 different sites, one in North Dakota and the rest here in South Dakota. And this program, my organization has been the grantee for this program for more than 25 years. But since 2015, we have called our staff in the various reservation communities, community health workers, and they have actually taken training through HRSA, through the Healthy Start program, they've taken a community health worker training. And what I'm interested in knowing is what is the process for having that evaluated to see if it would qualify them for the certificate here in South Dakota?
Sure, great question. So I will connect you if you just send me a quick email so I can respond to you. I don't have it right in front of me. I see Kathy put it in the chats there, but Sam Hines is the policy strategist through South Dakota Medicaid. She would be the one to start that conversation with about, here's the training program that our CHWs went through. Let's see if A, that could be added to just the list for anyone to jump on board as a training program, but also B, can you review that training program and see if that could be approved for a reimbursable training program. So I would definitely connect you with Samantha. I will try and multitask here and maybe even copy her email into the chat here as well and see if I can pull that off here.
I also put my email in the chat.
Oh, perfect.
And all of my staff are also certified by Johns Hopkins as family spirit health educators.
Yep. So then that should get you right there on board with some reimbursement. So I am just starting a blank email to you here so I can follow up with you. And I would love to connect further and see how we can work with your program to get on board with that Medicaid reimbursement and help help build up your already well-established program.
Thank you.
I believe Terry Rattler also has a question. Go ahead, Terry. I believe you're unmuted.
Okay, thank you. Yes, I have a home visiting program. I'm a federally grant funded program. And we have a home visiting program which utilizes Family Spirit and Sysadin.
Okay.
And so we have 2 community health workers there. And I was wondering, you know, for the Family Spirit, it's different, like it depends, like the referral will be coming from a physician. Is that correct?
Yes. Yep. For reimbursement, you mean?
Yes.
Yes. Yep.
So, and for Family Spirit, you know, we see prenatal women up to the age of 3. And so their visits are like from prenatal to till the baby is 1 year old. Those we do home visits weekly. And then when the child gets older, we do it twice every other week. And then they come to monthly. So like, let's say if there was a prenatal, or let's say it was a new mom that just had a baby and she got a referral from the physician, would the physician have to state like how long the mom could receive home visiting? Or is there just like after he refers her and we enroll her into the program that after she does the 52 visits, then the rest of the visits just won't be counted? Or how would that work?
Yeah, so that might be a question for Samantha. What my understanding is so far is that the provider referral or the provider orders can be somewhat generic and open-ended based on what the CHW thinks is best. So I would think for sure, you know, that could go through all 52 hours of service in one calendar year through Medicaid, and then after that, it wouldn't be funded. However, this would definitely be a question for Samantha, but got my brain thinking as well. If the baby is born and is also on Medicaid, then I wonder if that could count double, if that makes sense, if you're following me there. So instead of 52 hours total, it'd be 52 for mom, 52 for child. So then that would equal 104 hours or 208 half hours or units per year. Hopefully I did that math right off the top of my head. But that would be something I'd probably have you double check with Samantha about, just to see how that would work. But there is an opportunity in those provider orders to really tailor the orders for the specific patient.
Okay. Another question, who gives out this information to the physicians at the clinics?
You mean this information, like how to refer to the?
Yeah.
Okay, sure. So that would probably be something that I could, or not some, probably, it would be something I could work with your program to develop a plan of how to connect with those providers. And so, you know, maybe it's providing them with resources from the CHWSD, having them go through that planning and assessment toolkit first to give them a really great understanding of what CHWs are and how they work. But then it's also, you know, something that we're focused statewide on promoting, but also something that we can work individually with your organization to be able to pass along messaging and awareness and an introduction to those providers. I don't have a lot of experience with providers yet in South Dakota, but what I've gathered from other states, and I'd be happy to also connect you with, you know, with an organization in another state too. I found them super helpful. Once they start having the conversation about CHWs, it really only takes one provider, and then it's almost that domino effect where one provider is like, oh, I get what a CHW is. This is great. And then they tell their colleague and they tell their colleague, and suddenly everybody's on board with CHWs and is excited to have them within their clinic and organization.
Actually, Ben, Dr. O'Connell is on right now. Dr. O'Connell, maybe if you have a reply to that, you may be able to shine some light.
Yeah, thanks. So hi, this is Megan O'Connell. I'm a medical epidemiologist with the CDC Foundation and Great Plains Tribal Leaders Health Board, but I've also worked as a primary care physician and family doc. So in terms of shedding light, and then I have a question. I agree. I think particularly primary care docs, if you have a program and you let them know that they can refer people to you, that would be great. And they would be happy to do that. Or if the program is integrated with a particular system or program, that is something that I'm sure primary care docs would be happy to do. For example, like an FQHC might have its own community health workers. I had a similar question in terms of if you have how does that work if you have a kind of standalone community health worker program where you'd need potentially a medical director to provide the orders and then people would make referrals? Is that how that would work?
I believe so, and that's something that I know.
Kind of like home health or something like that.
Yeah, yep, that's something that Samantha I know is looking into, and we've been asked a couple times to kind of dig deeper into. So that's probably one of those like coming soon responses for you there. But looking at how can organizations bill Medicaid if they're not a traditional clinic or something like that, if they're more of an organization like that. So that's something that we're looking into to kind of solve and connect the pieces of that puzzle together to figure out what that could look like.
Okay, and I guess my understanding is you have to have, it has to be tied to their chart. And this is common in all Medicaid services, right? So if the provider, their primary care provider makes a referral and says they need a community health worker for these reasons, that would be sufficient for that kind of referral out.
Yep. Yep, it doesn't have to be very, very extensive. It can be. Some providers, I think, will write very extensive instructions in there, but others, it can be very more generic as well.
Okay, awesome. Thanks so much, Ben. I'm sure I'll be in touch.
Yes, absolutely. I can't wait. I'm excited for all the emails. I love getting an email that's not spam. So
I have one more question, if I could. Regarding those first, I think there were 3 different ways that someone would qualify as a client, a patient, yep, for receiving, the services reimbursed by Medicaid, and high-risk pregnancy came to my attention because we deal with pregnant moms and postpartum moms. And so where are I'm guessing that this would be the CMS definition of high-risk pregnancy. Is that correct? And if
yes,
so,
yep,
where do I find that?
Yep, so that's a good question. Let me pull that up here and see if I can go ahead and find out where that would be. But yes, these go off of the CMS definitions of what these chronic conditions are, as well as like high risk pregnancy. So let me see here. I know I saved it somewhere. Of course, it's one of those, I save everything in a folder, so. Yeah, I'm not finding it right off the bat here, but that'd be something I can certainly, if you just send me a quick email, I can connect you with that definition there. And really it's the qualifying condition and or the qualifying barrier. It doesn't have to be both. So, even if it's just high risk pregnancy or if it's high risk pregnancy and geographic distance or things like that, there's many different ways that a patient could qualify for CHW services.
Thank you.
Yes, thank you. Any other questions that we didn't get to yet? I'm looking here. Kathy said the Rapid City Master Health Programs here have developed a care plan process for our prenatals. Awesome. Any other questions or comments?
I guess if there are no extra, Ben, do you have like a final words, or maybe like a call to arms, call to action type of promotion to kind of help us, make the push, so this is a little bit more prevalent and a little bit more spoken about,
Yeah.
just to raise the awareness?
I do. So I would say I have 3 takeaways from this. The first would be to visit our website, chwsd.org, and you can sign up there to receive our newsletter and other periodic updates from the Community Health Worker Collaborative. The second is that I would really encourage you to go through the CHW Planning and Assessment Toolkit, and then also encourage others that you work with to go through that toolkit as well. And the third is that I would just really encourage you to connect with me in the Community Health Worker Collaborative. I know I've gotten a couple emails out of the chats, and a couple of people have said they've emailed me. So really that's what my whole position is just connecting with organizations across the state and beyond, and starting to develop these relationships to build out the workforce. So I'm definitely one of those people where I love meeting new people and traveling and things like that. So the last year working from home with my dog and cat as coworkers have been really hard on me. Thankfully, we have Zoom, because I'm the type where I'm like, okay, I want to, like Kathy out in Rapid City, I've been working with her and meeting with her on the phone. I can't wait to road trip it out to Rapid City and meet with Kathy. And I'd love to do the same with your organization as well. So my goal is to get to all 66 counties in South Dakota, and I'm 9 short so far. So I have a map, and if you're a county I've already visited, I will return. And if not, I will be extra excited because I can check you off my map as a county visited. So certainly check out our website. There's lots of great information there. We are constantly adding to it and developing it as well. And so that will all be announced and shared in our bi-monthly newsletter as well.
That's fantastic. Thank you so much, Ben. This has been a treat. I think everybody has taken away a lot of great things. I will include in our chat our post survey. So if you have some additional questions, you're always free to reach back out or input it into the survey. Or you can, like I say, we'll create a follow-up email that includes the PowerPoints, contact information for Ben and Samantha, as well as our own, of course. And other than that, thank you all for being here. This was a treat. Hope everybody took away a lot of great things. Again, thank you, Ben, for your presentation. I think it was wonderful, very well received.
Yes,
and,
thank you all.
Yeah.
Great information. Thanks so much.
Yes, I'm excited to connect with many of you, and have a great rest of your Thursday and a great weekend. It's just around the corner.
Absolutely. Thank you. Thank you all.
Thank you.